Perfect. Well, good morning, everyone. Thanks for joining us on this Friday in late September, which we've commented on. This is this month's Compensation Benefits Action Group. We're super excited to have just a really exciting presentation and some information to share in this meeting. And so we'll certainly be recording it. And I'll just go into some real basic housekeeping stuff. So we are recording. That's just a reminder to be cognizant of what you're sharing. Avoid sharing any protected health information or anything you wouldn't want posted to the website for folks to see. We do record because Friday mornings can be tough sometimes, and we want to make sure that this information is available to all of our stakeholders. So we will be posting that along with the slides after the meeting. Use the chat. There's a handful of folks here on my team that are helping me monitor the chat. It's a great way to communicate, ask questions if you're not able to come off mute. Like I said, we will be posting the slides. The slides will come out after the meeting and be posted to our website through the invite list that I use. And so if you're not connected to the invite list, but you would like to be, I'm going to drop our email in the chat there and I can get you added to that Google invite. We'll just make sure you get the agenda ahead of time with a reminder and then also the notes and the slides after the meeting. If you're listening by phone, welcome. Press *6 to unmute your line or *9 to raise your hand. I've turned on the closed captioning, which you can turn on or off on your own individual Zoom toolbar at the bottom of your screen. And then all meeting information for this meeting, as well as our other action groups and the full Direct Care Workforce Collaborative can be found on that website that I just dropped in the chat as well. We'll do just a quick roll call of attendance, but like I said, I think I'll wait on the poll questions just maybe mid-meeting or so, let a few more folks join us. So for the folks that are here, if you want to drop your name and your agency role in the chat, just how you're connected to this work, we'd love to just see who's here with us, do some networking, some familiar faces, but perhaps some new faces as well. So that would be great. And I'll come back to the polls, like I said. So while we're waiting, I'd just like to do a first meeting, just a level set for folks in case this is your first meeting with us. So first of all, welcome. We're so happy you found us. This is an action group subset, smaller group of the Direct Care Workforce Collaborative. So that full collaborative meets quarterly. We actually just had our full meeting last week on September 11th. And so that's just a really big meeting dissemination or information dissemination meeting where we just really share a lot of updates, a lot of what's happening within the state partners, not just within HCPF, but what's happening with our state partners. And we had a Workforce 101 presentation about how workers and providers could leverage those services in their own regions. And so we just share a lot of information in those. And then these action groups kind of take that information and decide what they want to do with it. So they are intended to just really reinforce the Direct Care Workforce Collaborative's purpose and vision, and tasked with identifying the problem, determining solutions, and developing and executing a plan, an action plan. Sometimes that's just learning more about it. So this group has really taken on an identity of just learning about what's available for resources in terms of benefits and health insurance and getting connected to the resources that are available to this group, both for workers and for providers themselves. So different groups take on different identities, but as long as we're kind of helping improve recruitment and retention of the workforce, we're feeling good about it. So that's a lot of what today's meeting will be as well. Stakeholder voice is paramount in these meetings. We'd love to hear from you. We love to know how things are going. If this meeting fits your needs, if there's something you'd like to see, we're really open to that and we love hearing your feedback. So continue to share those with us. And right now, it looks like, let me see. I know Deborah's here with us. I'm not sure Ashley's here with us, but I'd love for you to get a chance to meet our volunteer co-chairs. And so Deborah, if you'd like to come off mute and say hello.
Sure, thanks. Hi, everyone. Thanks for being with us on this Friday morning. My name is Deborah Lively. I am the CEO and president of Leading Age Colorado. And actually, this will be my last meeting to co-chair. I've been with the leadership team with the collaborative for the past few years, and I've just had an opportunity to come up at Leading Age Colorado to serve as their president and CEO. And so I just have to kind of take a few things off of my plate. And unfortunately, this is one of them, but I have really enjoyed my time with the collaborative, and I think this group does really good work. So I do appreciate you being here. And hopefully, I mean, if any of you are interested in joining the leadership team, just reach out to Brooke, and hopefully we can get somebody to really help Ashley out with the continuing work of this committee. So thank you.
Awesome. Thank you, Deborah. Yes, and hopefully Ashley will be joining us soon, and you'll get a chance to meet her as well. But yeah, if you're interested, or you know someone who might be interested in joining our team, we'd love to have you. It's a volunteer position. We really try to meet you where you're at in terms of like your bandwidth and what you're able to do. We do have like monthly leadership meetings that we have folks come to, and the leadership team is all the co-chairs of all of the action groups come together. So if you're interested, we'd love to have you. But just while we have a few minutes, I know Deborah said that this was her last meeting, but I just want to take just an additional moment to really thank her for her time. She's been here the whole time I've been here with HICPUF, so she's been a real constant in our leadership team, and we just super appreciate her commitment. She's done a lot of really great work in terms of helping support some initiatives like the Direct Care Worker Appreciation Week. That never would have came to fruition without her, and so we're really excited. To have had her for the time we've had her, and really excited for her next step. So just a quick moment, Deborah, thank you so much. Appreciate you. And we hope to see you around, but know that you're going to do wonderful things. So thank you.
Thank you, Brooke. And I do really appreciate you as well. You've been such a support, and I really appreciate you. Thank you.
Thank you. Thank you so much. All right, let me just check and see if Ashley has joined us. Um, doesn't look like she's quite here yet, which is fine. So I think actually, um, I'm going to run some quick polls now that we have a few more folks here with us, and then I will turn it over to our presenter for the day. So if you will just hold tight with me, I'm going to pull up some polls. And this is about which region you represent, so where you're joining us from today. I'll let that stabilize. All right, so let me share these results for us. So for such a small group, we do actually have some decent representation from our other regions, which is great. This actually mirrors pretty darn close to what we had at our full collaborative last week as well, missing kind of the Southwest and Southeast. Well, just like the Western slope, we're kind of missing in the Southwest region, which we're really trying to do some outreach and stuff for those areas as well. So, consistent compared to what we saw with our collaborative last week. So I think that there's something to be said for that. So, all right. So the second question, let me scroll up here, is how you identify on the direct care continuum. And if you've been in this meeting before, it used to be just a single choice. You could only pick one. But we wanted to acknowledge that a lot of us are taking on multiple roles. I apologize. I need to stop sharing this one so I can share the other one. I got really excited about this next poll. There we go. So we've made it multiple choice. So you can select the different ways you're connected to this work, because we know a lot of people, again, are taking on different roles. You may be working full time, but you may also be a caregiver. And so just being able to select all the ways you connect to this work, we love being able to see that. So I'll give that just a minute. Perfect. All right, let me share these results. And this will probably also be helpful for our presenter as well to see kind of who's joining us today. So we aren't welcoming any workers or members or family members today, and that's okay. But we do have some employers, some advocates. Of course, our government agencies are always well represented, trade orgs. And then if you selected other, I'd love for you to just drop in the chat what that captures, and if I need to update this to capture maybe some other roles as well. All right, and then last but not least, we like to know, I did it again. I'm going to blame Zoom for this, that it makes me stop sharing before I can share a new one. That's what I'm going to say, is it's different this time. This is how you heard about us. We like to keep track of the best ways to get information to you. Give that just a moment. All right, let me share these results here. All right. So, how you heard about us? Lots of folks hearing about us through that HickBuff newsletter communication. We typically call that John Barry's newsletter or the Constant Contact, coming out twice a week. They've kind of revamped it a little bit. It's got a lot of great information, a lot of dates on upcoming stakeholder engagement opportunities, not just for our team, but for all of the Office of Community Living. And so we really like to share getting connected with that. So I'm going to drop that into the chat and you can sign up for that newsletter if you're not already connected on that link. And like I said, it just connects you with all the things happening in OCL, not just our work, but all the peripheral work that's happening too. So it's a great way to just kind of keep in touch. All right. With that, I think I'm going to quit sharing and hand it over to our presenter. Kathleen, are you here with us?
I am, Brooke.
Perfect. It is all yours.
All right, thank you. I think this poll there, let me just close out of that poll. So thank you, everybody. I really appreciate the opportunity to be here today. I'm Kathleen Bottagero. I'm with Gary Community Ventures and the My Friend Ben project. I'm going to go ahead and share my screen. So everybody should see a blue screen that says "Want to build a foundation of financial stability for families."
We sure can. Yes.
Okay, great. Thank you. We're more of a Google Meet shop, so I'm always navigating the Zoom. So I appreciate Brooke's invitation to be here today. Gary is a philanthropic foundation based in Denver, and our areas of focus are early childhood youth success and family economic mobility. And the work I'm going to talk to you about today, My Friend Ben, derives from the work in family economic mobility. Gary had a direct cash assistance program with families where we were giving unrestricted cash each month, and they were engaging with us in conversations about some of the pain points in their lives, be it something to deal with their child's school or just how they were paying the bills every month. And one of the themes that we kept hearing about was public benefits. Out of the over 100 plus families that we had in the program, 87% raised a concern about public benefits. Some people kind of knew about them, but had some mistrust issues or just didn't, were concerned about the time commitment involved in trying to figure it out. Other people were very familiar with the system, but got a lot of frustration in terms of trying to figure out if they were eligible, if it was worth their time to apply and go through the process. So it was based on those conversations that we created with these families and with other community members a tool called My Friend Ben. So My Friend Ben is an anonymous, fast, and free tool that helps connect people to the public benefits they're eligible for. When we talk about public benefits, we describe them broadly to include traditional public benefits programs like SNAP and TANF, but also tax credits, because those can put meaningful cash into a family's pocket, and nonprofit programs also. We have over 50 programs in the tool. I have a list I can share with you. We show a family their anticipated eligibility, cash value of the benefit, and time to apply, because the idea is we want to empower people to make decisions that are best for their family. So when they get the results, they'll see a list of things they may be eligible for, and then they can make the decision based on how long it may take to apply and get the benefit, what they think the value would be, whether they want to prioritize certain benefits, pursue certain ones and not others. What you see on the screen here are some screenshots from the mobile version of My Friend Ben. The tool is mobile optimized. You don't need any kind of special app that you have to download. You just go to the URL and you can do it on a computer, a laptop, or a mobile device. And some of the results you're seeing here will be a little bit more obvious when I go through a live demo and show you how the tool works. My Friend Ben meets people where they're at. The tool is anonymous. We do not collect personally identifiable information. We really believe in the privacy feature of this tool. There is one page where people can opt in to provide information, and I'll share that with you when I go through the demo, but it's completely optional. We don't have any gotchas where you give us this information and then to get your results, you need to give us an email or cell phone number. So you can go through it completely anonymously. We're flexible. We do not ask questions about citizenship because we know that there can be real trust issues with people wanting to share that, even if it is an anonymous platform. So we do have citizenship filters on the results page so people can apply those filters and see what program eligibility may change if they don't have full citizenship status in this country. And so I'll share that with you when we get to that page in the demo. We're accessible. We're in 11 languages. The languages are all listed there. We're convenient, designed for mobile, and it's taking people on average about 6 minutes to complete the tool. For this group especially, I think it's important to know that we really focus on the different categories of programs that can support an individual's or a family's social determinants of health. So you see those categories on the screen, and these are the categories of benefits that we have in the tool. So we have healthcare, food and nutrition, cash assistance, housing and utilities, childcare, preschool, youth, transportation, and tax credits. And I'll show you on the results page how the programs that someone may be eligible for are all put into those buckets of categories. We have worked with well over 100 partners to co-design and develop this tool. Just a smattering of some of those partners are on this page. I will mention some of our key integrations, which are listed on the bottom half of this page. We have had integrations with Get Ahead Colorado through CDPHE. So we've had a My Friend Ben link on their website. 211 Colorado, we have trained all of their call center workers, and we have My Friend Ben link on their homepage too, so people can come in and determine what benefits they may be eligible for through 211. We have a co-branded page on the Jeffco Human Services website, and we've worked closely with their child welfare caseworkers to bring My Friend Ben into their workflow. We are launching with Denver Human Services. You can find My Friend Ben on a number of their website pages, and we'll be having a more formal communications announcement with them in the next couple of weeks. And then we're also integrated with Colorado Coalition for the Homeless. I'm going to get out of this screen now and let's see. Okay. So I think with Zoom, you can just see the screen now that says My Friend Ben. Can you see that, Brooke? I got out of the deck.
Yes, yep, we can
Okay.
see the web page.
Okay. All right. Thank you so much.
Yeah.
So one of the really exciting things we're going to be ready to announce soon is that based on the success in Colorado, My Friend Ben is going to go national. We are close to launching My Friend Ben in North Carolina with more states to come. So if you go to myfriendben.org, that will take you to the national page. This is the Colorado page, and I'll make sure all of this is in writing that Brooke can share with you after this presentation. So the URL we have is co.myfriendben.org. This web page here is in the process of being refreshed, and it's going to look completely different in the next couple of weeks. So this is our homepage currently. You click Get Started. And then this will bring you to step 1 in the tool. As I mentioned, we're in 11 languages. You can toggle to languages either by coming up here to the drop-down menu, or you can come here. So we're going to go through this in English. We did, but because I mentioned we take user comments into account. This was a step we didn't have when we first rolled the tool out, and we heard from a lot of people that they wanted to know what languages would be available. When we added this, uptake of Spanish language use almost doubled overnight. So this is one of the ways we've improved user interaction with the tool. So I'm going to click Get Started. This is our landing page. It has 2 important reminders. My Friend Ben is a tool that estimates eligibility. We are not Colorado Peak. We're not trying to be Colorado Peak. So you do have to actually go through the application to determine your eligibility. We're just giving you an idea of the information that we think you're, the programs you're likely eligible for based on the information you provide. We also have a link to the CDHS public charge page. This is a highly popular link. A lot of people are concerned about public charge implications, and so they get a lot of clicks on that link. I'm going to click that I'm ready to go. I'm 13 or older, and click Continue. I will mention too, I'm going to pause for a minute and let you know this is screen readable also, so someone can go through it with that also. It might be important for this group. We are available statewide. You put in your zip code. I'm going to use a Denver zip code. When I put in the zip code, it knows what county or counties I may be in. So in this case, it's Denver County. Click continue. Then we have some basic demographic information about the household, starting with the number of people in the household. I'm going to demo with a 2-person household. We ask about the age of each individual household member. So in this case, I'm going to say that the head of household is 33. We ask about the type of health insurance each individual family member has, because if, for example, a household member already had Medicaid and we thought they were eligible for Medicaid, we wouldn't show Medicaid in results. But I'm going to say this person does not have health insurance. You see, we've tried to capture all the different categories of health insurance that someone may have, from Medicaid to employer insurance to Medicare to CHIP Plus. So I'm going to say here, I don't have health benefits. We ask about certain conditions that each household member may have. I'm going to say that this person is pregnant. And then we ask about income for each household member. You'll see too, as I go through the tool, that we have these question marks throughout. Those are help text. So if you had a question about income, for example, and you were wondering, is the tool asking for gross income or net income, you would click that help button and it would give you some information. It says, in this case, income is the money earned or received before deducting taxes. So we're asking for gross. I'm going to click yes. And when I click yes, additional fields open up. We have a variety of earned and unearned income sources that people can put in, because some programs do distinguish between the treatment of earned and unearned income. I'm going to say that I have wages, that I make an hourly wage. I'm going to say I work 30 hours a week and I make the Denver minimum wage of $18.29. If I had other income like child support, for example, freelance work, I was doing DoorDash on the side, I could continue to add other income sources. I'm just going to click X here to get out of that. Click continue. I'm going to say the next person in my household is a 2-year-old. Again, several different relationships here. I'm going to say this is my child. My child does also not have health insurance. No special conditions apply. And because it's a 2-year-old, there's no other significant income in here. Click continue. We ask about household expenses because those can impact benefits, particularly as it relates to a program like SNAP. So I'm going to say yes. And when I click yes, again, different fields open up to ask me for more detail. So when I go to expense type, there's a list of expenses here. People like to provide detail. I'm going to keep this simple in the interest of time. I'm going to add 2 expenses. I'm going to say that we pay rent of $1,200 a month, and I'm going to add part-time childcare of $400 a month. I could keep going. I'm going to click continue. We ask about cash on hand. I'm going to say that this household has $200 in cash. We ask if the household has any benefits. This was another step we added based on user feedback. People told us that they were already on SNAP. They didn't want to see SNAP in results. It felt like overcounting. So if I click yes here, this menu opens up with the different programs that are in the tool. So let's use TANF as an example, since that's up here. If I were on TANF, I could click this, and then even if the tool determined I might be eligible for TANF, it wouldn't show up in results. Going to deselect that. If it feels too personal to answer yes or no on this question, you can just say prefer not to answer and continue on through the tool. Going to click continue. This page is very popular with people. So a lot of traditional benefits are more longer term programs, but perhaps you think you might be eligible for SNAP, but you're worried about finding food for your family this weekend. You may have more of a near-term need. So these are programs that might connect people with some other resources that they need outside of traditional benefits. So we've got food or groceries, which I'll select here. Diapers and other baby supplies. We also have categories: help managing mortgage, rent, or utilities. A challenge you or your child would like to talk about. Those are mental and behavioral health resources. Concern about child development, family planning or birth control, job resources, low-cost dental care. This is also a very popular one, so I'll check that. And then low-cost help with civil legal needs or IDs. I'll click continue. We ask about how the person heard about My Friend Ben. You'll see that some of our key integration partners that I talked about earlier are in this drop-down menu. We try and keep this very limited because one of the challenges, of course, is not wanting people to have to scroll through 100 partners as they go through this. So if you are just playing around with the tool yourself to kind of see how it works, we would ask that you click Test Prospective Partners so that we don't mix up made-up data with real data. If you are working with you're an advocate, you're working with a client, you could always click other and then type in how you heard about it, via this program. So since this is a demo, I'm going to click Test Prospective Partner and go on. This is the one page I mentioned where people can opt in to provide personal information. So there are 2 boxes here. The first one says, please notify me if new benefits become available I'm likely eligible for based on the information I provided. We've used this a couple of times. Colorado earlier in the year had a temporary rental grant assistance program. It was active for a few months. We were able to match people on the back end with the income qualifications for that program with people who checked this box, and we sent out emails and texts letting people know that that program was available. We had like a 40% click-through rate, which is huge for something like that. So that was one way we've used it. The city of Boulder recently had a limited application available for young families to get some direct cash assistance. We used it there. We matched up people with their profiles on the back end and sent out a text and email telling people they had 3 weeks to apply for this direct cash assistance program. So we continue to play with this tool and roll it out because we think there's a lot of power here. The second box says, please notify me if there are paid opportunities to provide feedback. We do work with people, give them gift cards and use their input to improve the tool. If I click one or both of these boxes, then additional fields open up where I'm prompted to give my first and last name and either an email or a cell number. But again, completely optional. If I deselect, I can just keep moving on through the tool. This is a summary page, so you can look at the information that you input and confirm if it's correct or not. If you want to go back and correct something, you can click on that pencil. It will take you back to that page. You can make your edit, and then it will take you right back here, so you don't have to go through the whole tool again. That was another improvement we made with user feedback. I will show you later how you can also use that as kind of an informal Cliff calculator. I'm going to click continue. Again, it's taking people about 6 minutes to get through the tool. This is my results page. So for this particular household, the single mother who's pregnant with a young child, we found 15 programs that they may be eligible for. Estimated monthly savings of just under $3,200 a month, and then annual tax credit of about $9,600 a year. This is another change we made with user feedback. We used to combine the monthly savings with the tax credits, and people felt like they wanted that information to be separated out because of the different nature of the programs. So now you can see that clearly laid out here. So 15 benefit programs. We list them by ranked order value. So we start with housing and utilities. We have the Colorado Emergency Rental Assistance Program. Because I'm in Denver, the temporary rent assistance and utility assistance program comes up. If I had used a zip code other than Denver, that program would not have been in here because the results are customized based on county. You will see here housing and utilities. You may notice we have the weatherization assistance program. We don't have LEAP. The tool does stay up to date on what's active and what's not. So if we were going through this tool middle of November instead of today, you would see LEAP in results also, no likelihood. Here are the tax credits that we have. Healthcare, in this case, Medicaid. We have CCAP, different food and nutrition programs, SNAP and WICS, since there's both a young child and a pregnant woman in the household, and then RTD Live. If you look at each category or each program, you can see here, SNAP, we're telling people approximately 2 hours to apply, including interview time. Estimated savings a month, what they might get in SNAP benefits. If they want more information, they can click there. To apply online for programs that are available in Peak, that apply online button takes them directly to Peak, where they can then go ahead and apply for the particular benefit. For a program like Lifeline, which is federal phone assistance, we would take you to that very short federal application for that program. So this is customized based on the program. If someone needs help applying, we have some vetted organizations in here. Benefits in Action is a statewide navigation organization based in Lakewood. They have a breadth of experience with benefits assistance. We're a community connection. And then because this is SNAP, we also link people to Hunger Free Colorado statewide hotline for assistance. We list the required key documents that people may need because we hear from navigators that often that's one of the holdups. People show up and they have no idea what information they may need. So we try and give people a little bit of a roadmap for that. And then we have a description of the project. We run everything through a readability tool, so it comes in at about a middle school reading level. back to my results. I mentioned we don't ask about citizenship, but we have a citizenship filter. So here, my 15 programs, if I'm curious what happens if household members do not have citizenship, I can click that box. I still have potentially 10 programs that are available to this household. A couple of things change, like my Medicaid turns into emergency Medicaid, but Colorado still has tax credits that are available. WIC is still available to people who don't have citizenship, even though SNAP goes away. So the filter has several different types of category. If you come here to green card holders, there are different categories. Do you have to have had your green card for at least 5 years? You know, just having your green card, is that enough? So people can play around with these filters also. I mentioned that the near-term benefits are a popular feature in the tool. If I come here, I checked a need for food, diapers, and low-cost dental care. So in this case, because I'm in the metro area, I'm linked to the National Diaper Bank Network. If I want more information, I can click there and it will give me some information with a link to the website. Also, because I checked food, Hunger Free Colorado has a statewide food resource hotline. Benefits in Action delivers food to people in Denver, Adams, Arapahoe, and Jeffco counties if they can't otherwise make it out for food. And then Meal is a program that's run by Bright by Text. It's available in Denver and Jeffco only. But if you text this number to, you text a meal to that number, you get texts where they may say, you know, food event at Empower Field this weekend, 1 to 3, bring a bag. And so it's meant to really connect people with some of those more immediate resources they may need. And then for dental care, we link to the Colorado Dental Association website. They have a statewide list of low-cost dental clinics. We'll come back to long-term benefits. The other thing people can do then, every profile has a unique identifier. And so you can save your results knowing that they are absolutely unique to you, no one else. So if you come here, you can bookmark the link if you're on a private device. If you're doing this at like a library, you wouldn't want to do that, but you can still save the results by emailing or texting them to yourselves. You can fill in these boxes any number of times. So if you want to send them to a family member, to someone who's helping you apply for programs, you can go ahead, have the results emailed or texted to you. And what you do is when you do that, you get a link and you would click on the link, it brings you back to your results page. And so the cool thing about the way that works is, again, we're sitting here in September, LEAP isn't in results, but if I were to click on that link in November, then LEAP would show up. So my results would constantly be refreshed. And then I want to show you, because we get this question sometimes, we've talked about building in a cliff feature. We don't have that yet. But if you go back here and let's say I put in, I'm making $8.29 an hour. I know Denver minimum wage is going to go up in January, and I'm curious about what that might do to my results. I can go back in and edit that step, change my my wage, and then rerun the results. And I can see, oh, you know, my SNAP benefit goes away or my SNAP benefit goes down by $100 or whatever the impact might be. So that's one way to use this as an informal cliff calculator. I'm going to go back to the deck momentarily, and then I also want to share with you the list of benefits that we have. So we have a Get Started guide with outreach materials, and I'll also share the link to this with Brooke. So Brooke will have the slide, she'll have the list of benefits, the link, and she'll have this. We have flyers, social media posts, newsletter articles, text messages. The flyers have QR codes also that people can scan and then go directly to the tool on their phone. Most of the materials are available in English and Spanish. The flyers also are available in Vietnamese. And you'll also have my email address. I want to show you one other thing, and I'm probably going to need to stop sharing and then share again because I can't read the top of my screen with Zoom. Okay, so you can get to this through our homepage. It's called Current Benefits. And this is the list of benefits that are in My Friend Ben. So we have 42 long-term benefits. You'll see the tax credits are all listed here. And there's just like a one-line description of what the program is. We do indicate if there's a restriction, like my Denver card is available to youth in Denver County only, Denver preschool program, Denver only. For LEAP down here, we mentioned that that's a seasonal program available November through April. So this gives you a full full guide to the benefits in the tool. As we add benefits, this gets updated automatically. Food benefits, we have Everyday Eats, which is food support for people 60 and older, cash assistance programs. And then these are the near-term benefits. So, food, dental, housing, those kinds of things. This lists those benefits also, so you can have a look at what is available in the tool. So that is a lot of talking. I am very happy to answer any questions. If the chat is active, I can't see it yet, but if I stop screen sharing, I might be able to.
The only question we had coming in, Pat, was from Pat, was just to share some contact information, which you did for them. So are there any other questions for Kathleen? I have to say, Kathleen, this is even more than I thought it was. This is incredible. We're really excited.
Yeah, I do have a couple questions.
Uh-huh.
Yeah, I think this is an amazing tool. Thank you so much for being here and sharing with us. Is the foundation, you said it's the Gary Foundation, is that right?
Gary Community Foundation.
Gary Community Foundation. Are they planning on maintaining this for the foreseeable future, or are you eventually gonna have to turn it over somewhere, or what are the plans going forward, I guess, is my question.
That is a great question. We are getting close to making an announcement that we have some national funding available also. So I do think this will have a little bit more of a national aspect to it. Gary is a sunsetting organization. So the idea was, it was founded by Sam Gary. The idea was to take the assets and distribute them in the community where they could live on in perpetuity. And so that is what we're doing by supporting this program right now. It will always be Colorado centric. It may just live a little bit outside of Gary Community Ventures.
And then my second question is, how do you get information about the benefits? Like if there is something maybe that a group knows about and they would like to let you know, or kind of how that works too.
I'm the person who pretty much, I didn't really even give my title. I'm manager of research and partnerships. So I work with community partners, do demos like this. I also do the research for the most part. And in terms of your question, Deborah, for example, Denver County, Denver Human Services has some programs that they wanted to get in the tool as part of the white label version that we're doing with them, the customized version. And so we added a number of Denver programs working closely with Denver Human Services people. So if someone has a program that they think would be beneficial that they would like to have added, you can email me. And again, I'll make sure my email address is available to everybody after this call. What we are trying to avoid is we don't want to be like a Yellow Pages where it takes people, 10, 20 minutes to kind of filter through all the resources. So we're pretty selective in terms of what we add. We have some criteria in terms of, the depth of the problem that the program is trying to serve, the breadth, how many people in the community might be affected by it. Is there meaningful value to a family or an individual? So all of those factors are taken into account, but we are very open to conversations with anybody who has something meaningful, because we recognize there may be things out there that that we don't know about, and we rely on experts in the community like you to help direct us with some of those resources.
Great, thank you very much. Appreciate it.
Thanks, Deborah. Michelle, I see you have a question.
Hi, thanks for this presentation. I'm just curious if you could give a little bit of information about what some of those partnerships or customized versions that you mentioned, like what those look like or what the opportunities potentially are.
So, well, for example, let me I can show you what this looks like on the 211 website. So let me share this briefly. This will give you one idea, Michelle, of what this looks like. So this is the 211 Colorado homepage. So when you go there, you can get to My Friend Ben a couple of different ways. There's a button here, click Government Benefits. It will take you to this co-branded version of My Friend Ben. 211's a little bit unique because the tool is thoroughly co-branded throughout with 211 because they're such a huge partner. So you'll see here it's 211 in partnership with My Friend Ben. And again, I apologize with Zoom. I have a hard time seeing the top of my screen. So bear with me as I go back and forth on this. The toolbar just blocks out my tabs at the top. We're also partway down here also on the on their page. If I can find this right there in the middle of the page too. So again, if you click get started here, that would take you to that page. I'm going to show you what it looks like with Jeffco Human Services. So we're under a couple of different places on their website also. So under collaborations, for example, you'll see my friend Ben. It would take you here, and then you'll see we have the co-branded version with Jeffco Human Services logo and my friend Ben. Some partners, we have a my friend Ben logo. When we have an integration like this, we also create what's called a UTM link, which enables us to collect data specific to that link and then create data dashboards for the partners who are working with us. So that's one example of how it could look. Also in the case of Jeffco, their child welfare caseworkers have built my friend Ben into their workflow, you know, as they maybe get ready to work with an 18-year-old getting ready to be emancipated and out on their own and trying to figure out, you know, how they're going to pay the bills. They have it built into the workflow as they try and get a child back into their home, possibly after some kinship care. They use the tool. So I have done a number of trainings in person and virtually with the caseworkers at Jeffco to help educate them about the tool. So those are some of the ways. We have customized flyers where we can do unique links, also to provide data dashboards for people. We do ask that there be some meaningful uptake, you know, of the tool, some kind of broad audience like we have with 211 or Jeffco in order to take on that customized, the truly customized work. But the tool is otherwise freely accessible, available, free to anybody else who wants to use it.
Great, thank you.
And then just a comment from Pat in the chat. Glad to know this resource is here. Hoping there'll be some sort of FAQ to problem solve COVID issues that folks call me about daily. Redetermination is a big topic for them. So it sounds like maybe even that piece of like being part of the workflow or something could be just a consideration for some folks that are having these questions come. I think Pat, your work in human resources, is that correct? Let me scroll back up here. Oh, no, sorry, I apologize. Oh, an advocate. Okay, yeah.
And we hear about the pain points people have with redeterminations. The tool currently doesn't help with that, but that is definitely something on our radar, Pat, and something we would hope to develop at some point. Right now, this is more of an educational tool to help people who may not be aware of some of the programs about what may be out there that they're entitled to.
Perfect. That's great. Any other questions for Kathleen? Well, I will make sure that we get all the contact information, all the resources from you, Kathleen. I also think we'll probably post this recording to our collaborative website too. We don't typically do the action group meetings, but I think with this information, it's certainly something we'd like to share and just kind of continue to have conversations. I'll talk with the co-chairs. This might be something we want to bring to the full collaborative as well, just because I think it touches not just members and workers, but also just like as providers and employers trying to help connect folks to resources. So just a lot of great information.
Great. Well, thank you, everybody. I will have a complete list of items that I send to Brooke after this. It'll include my email, so please feel free to reach out if you have any questions.
Awesome. Thank you so much, Kathleen.
Thank you all. Bye.
Thanks. Bye. All right. Well, let me get us back into our slideshow here. Being cognizant of time, we wanted to give most of the time to Kathleen for questions and discussion, but we do want to take time for an open forum. So this is just a time for announcements, questions, thoughts or remarks, anything that's happening in your space you'd like to share with the group. I'll just kind of give folks a minute to chew on that. Heather, please.
I wanted to plug two things. Today is the last day the direct care worker survey will be open. We have 1,102 attempts, about 800 and a little over 800 are completed. So if you know any direct care workers in the state of Colorado, please send them that link, encourage them to fill it out. I would like to offer that this is our third year and we got like 750 the first year, like 850 the second year. So we're doing pretty good with getting up the numbers. And also there's a lot of consistency in what people are saying year over year, which I think is pretty helpful. We will have something published on our website about that soon. We're just in a backlog of a lot of ARPA and a lot of publications going out. And so I know we've been saying it's coming. It's coming, I promise. And then the other plug I have is that the base wage attestations were due August 30th. Payment holds are starting this week. So if you are an employer and you have not submitted your base wage attestation, please get that in ASAP. If you have questions, you can email us at our base wage inbox. And if you are ever on the Collab site, we have a whole spot dedicated to base wage. So you can check out their memos, the process, and a little bit later today, we'll probably have all the agencies posted who have not submitted or who have not completed their submission, barring safe harbor. So anyone that serves 30 or less posted just because of our safe harbor rules, but they would still be subject to the penalties if they don't submit. Thank you.
Perfect. Thank you, Heather. Any other announcements, questions, happenings? All right. Well, let me just, if something pops up, just raise your hand or throw it in chat. I can pause. I just want to do a quick reminder of upcoming meetings. Our next Compensation and Benefits Action Group meeting is Friday, November 15th at 10 o'clock. Hopefully we'll have maybe some information from that survey, Heather, that we can look at. If that's posted to the website, we'll bring those results to you all, which I think would be good because I do believe there's quite a bit of benefits information being received through that. So that'd be great to look at. So we'll take a peek at that. In the meantime, if you or someone you know is interested in joining Ashley as a co-chair, feel free to reach out to me. I'll drop my email in the chat for folks and we can have a conversation about it if it's something you might be interested in. We're pretty non-committal, so you can just talk about it and I won't make you do it. So, and then our next collaborative will be Wednesday, December 11th, 2024 at 10 a.m. As I mentioned, we did have a full one last week, and the posting of the slides and the recording are both on our website now. So if you weren't able to make that, but you want to take a peek at the recording, that is posted, and I'll drop that in the chat as well. Just some resources that I'll drop in the chat, but they'll go out in notes as well, so you don't have to frantically save them. But Deborah, Ashley, any final thoughts before we let folks continue on with their Friday?
That was a great presentation, and it's going to come in handy for a lot of people.
Yes, I agree. That was a lot of great information. Really excited to post that to the website and get it shared out with folks. And if it's something you want to see at the larger collaborative, if you want to continue to engage with my friend Ben as they get updates on the cliff effect and things like that, we'd be happy to do that as well. So there are some resources for you all. If there's nothing else, we'll let you get on with your day. Thanks, everyone. Have a good day.
Thank you. Appreciate it.
Just gonna... Oh my gosh, what did I do here? I'm trying to save the chat. There we go. There it is. All right, we're good. All right. We'll see you later, Jazz.